Could retatrutide affect your skin? That's exactly what we're looking at today. And it's a question more people are asking as this investigational medicine moves through clinical trials. So first, what actually is retatrutide? It's an investigational triple agonist for weight management, meaning it hasn't yet received marketing authorization from the MHRA, the EMA, or the FDA. It's still being studied. But as it progresses through trials, questions about its potential side effects are growing, including whether it can cause skin sensitivity. What makes retatrutide different from medicines like semaglutide or tirzepatide is that it targets 3 hormone receptors simultaneously: GLP-1, GIP, and glucagon. That broader mechanism is why researchers are interested in how it might affect systems beyond just blood sugar and body weight. Now, when it comes to skin sensitivity specifically, it's important to be clear. This has not been confirmed as a primary safety concern in published phase 2 trial data. The most commonly reported side effects were gastrointestinal, things like nausea. That said, some trial participants did report injection site reactions, redness, swelling, and itching, which are consistent with what's been seen with other GLP-1 based medicines, so they're not entirely unexpected. There are a few possible reasons why broader skin changes might occur, though the science here is still speculative. Some early research suggests GLP-1 receptors may be expressed in skin-associated cells, but this hasn't been well established in humans, so it remains hypothesis generating rather than confirmed. Glucagon receptor activation can influence vascular tone and inflammatory signaling, and GIP receptor stimulation has shown some immune modulating effects in preclinical models. Whether any of this meaningfully translates to skin sensitivity in people taking retatrutide simply isn't known from published clinical data yet. One indirect factor worth mentioning: significant weight loss can itself affect the skin. Rapid changes in body composition may alter the skin's barrier function, potentially leading to dryness or heightened sensitivity, so any skin changes may not be directly caused by the medicine's receptor activity at all. Because retatrutide hasn't received marketing authorization, there's no official summary of product characteristics yet. The document that would normally provide detailed safety and prescribing guidance. Until that's published, the picture is still developing. If you're taking part in a clinical trial involving retatrutide or following its development as a future treatment option, here are some things worth discussing with your healthcare professional or trial team. Ask about what skin-related symptoms have been observed in the trial context, how injection site reactions are typically managed, and whether your personal skin history, for example eczema or existing sensitivities, is relevant to your suitability. And importantly, if you're in a clinical trial, always contact your trial team before making any changes to your treatment. On the safety side, most injection site reactions are generally mild and short-lived. However, if you experience a widespread rash, significant swelling, difficulty breathing, or any signs of a severe allergic reaction, call 999 or attend A&E immediately. For any suspected adverse reactions, whether to an authorised or investigational medicine, you can report these in the UK through the MHRA Yellow Card scheme. That link is in the description below. So to recap, retatrutide is investigational and has not yet received marketing authorization in the UK. Skin sensitivity has not been confirmed as a primary safety signal, though injection site reactions have been reported and are consistent with similar medicines. The possible mechanisms are plausible but remain speculative. And as always, any concerns about side effects should be discussed with your doctor, pharmacist, or trial team. Never adjust or stop a treatment without speaking to them first. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please like this video and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.